So one question that I get a lot is how much education does a dentist need before they are able to practice? Basically, there's a group of requirements that are needed for you to be accepted into dental school. So a lot of people that are going that route will do a science undergraduate degree because a lot of those requirements are taken care of in a science degree. But ultimately, it takes about 3 to 4 years of undergraduate work to be able to satisfy all the requirements needed to get into dental school. A lot of people, by doing that, will go ahead and get an undergraduate degree as part of their training. But basically, it's 3 to 4 years of undergraduate training and then 4 years of dental school training. After that, if you pass all your board exams and licensing exams, you are able to go into the world and practice dentistry. And I think that's a pretty normal track for a lot of people, but a lot of people also will choose to continue a formal education track through a residency program. That can be anywhere from 1 year up to sometimes 5 or 6 years into the specialty residency programs. And dentistry has a whole group of specialties that are formally recognized that require anywhere, like I said, from 1 year up to maybe 6 years. So the answer that I give people, it's about 8 years of training outside of high school to be able to get your dental degree and your license to practice dentistry. The advice that I give dental students a lot is to go out and get as much experience in the different areas of dentistry prior to going to dental school and graduating dental school. So one area that I tell a lot of dental students would be to go learn about the business side of dentistry. So go learn the business team operations, how the insurance processing goes, and how the patient interaction and the financial end of dentistry, because that's a huge part of practice, because you just really truly need to understand that. Another area is the laboratory processing, so learning all the laboratory skills and materials that are used in dentistry. We do learn a lot of that in dental school, but to have a much deeper background would be so beneficial prior to going to dental school. And lastly, just go into dental offices and shadow dentists, so you can see how different practitioners do it, different setups, and there's just so many ways to practice dentistry. It's always just great to see different environments, because a lot of times once you get into practice, all you see might be what that particular group does. So I always say the more experience or time in an office you can do, the better. So I feel it's incredibly important to always get out and travel really the world and learning new techniques and new skills. Some of the best learning I've ever done is when I find a group that is doing really innovative and great stuff. And typically these groups offer training programs, and you go there and it's a big commitment. Sometimes you're spending 7, 10, 14 days in a different country learning, but seeing that there's a different way to do things and they're producing great results allows you to be able to compare and contrast of what you're doing versus what they're doing, and take home some great knowledge and great techniques that I can bring back to the practice and bring back to our patients here. And I feel that being on that process continuously is the most important part. Never stopping, never feeling satisfied that you truly know everything, or that the way that we do it is the best and only way. I think having your mind open to be able to learn that there's maybe a better way out there of doing things, and at least considering those techniques and those strategies. Certainly making sure that there's literature and data to support those strategies. Always having your mind ready to learn and ready to grow, and knowing that, and not being stuck in your ways that this is the only way to do things. With technology and advancements in medicine across the board, it is so rapidly changing that really truly each area that we do is growing month by month. So to not be on the cutting edge of that learning process, you can be behind very, very quickly. So I personally love the process of learning, and I love just being engaged with the most brilliant minds out there in the field of dentistry, and just learning from them and growing, and adding my own input and my own spin on how we do things, and bringing that back and helping us serve our patients. So I just love the whole process, and just grateful and honored to be able to bring that back to our patients here.